The views and opinions expressed on this program do not necessarily reflect those of the advertisers, owners, or management of Pacific Telestations, LLC. For comments, opinions, and questions, please email Jess Lujan at jessthebuzz@gmail.com. The Buzz with Jess Lujan.
And we're back with my studio guests, of course. Actually, we're not in studio. We're on location with Senator Dennis Rodriguez in his mobile health clinic, and we're here in Dedado. Again, thank you very much for allowing us to come into your clinic.
Oh, thank you.
No patients today,
That's
but
right.
yeah. But Senator, let me ask you this, because you're, this clinic will be provided for the doctors and nurses, the healthcare workers, basically, that will give their times, or volunteer their times to come out to the community and reach out to them. But let me ask you, because some of the things, of course, when patients come in, you have to take you have to take their records, retrieve their records, and things of that nature. Who keeps those? I mean, we're not trying to find out where that is,
Sure.
but patients want to say, hey, I want some confidentiality. I want to make sure that they put my name down,
Sure.
things like that. That what I've been diagnosed, whatever. That's in confidence.
Yes.
So how can people
Sure.
know that these things will be in confidence, where they're going to be stored, and
Sure.
and all that?
Great. I can tell you what the procedure was last week.
Okay.
We had, for example, Dr. Shea and his team of nurses that were here. They were doing ultrasounds here.
Okay.
So they would, they have their own chart,
Sure, sure.
and so they would take the information down, and they keep it, right? And these are not his established patients.
Sure, sure.
What he does with that information, I'm not too sure,
Sure.
because it's a mission. It's
Sure,
a medical
sure,
mission.
sure.
Those that were here, the nurses that were here doing the immunizations and the skin test, the TB skin test, we were under the guidance of public health. So the information was kept with them. We had DOE nurses that were administering those, and so we also had them on site to input those information in their system, right? So that's in that setting where we had the immunizations and we had physicals. No one kept a copy of the physicals. It was doctors here, did the physical, the forms that came from the schools, signed off on it, and gave it back to the parents.
Oh, the parents.
right?
Okay.
To the
So
parents.
they'll keep their own records,
That's right.
basically.
So
Okay.
nothing was kept
Okay.
here. I know for the immunization, they keep it for record purposes,
Sure,
right?
sure.
That was public health and the GDOE nurses. But moving forward, when we talked earlier about how we need to have that whole follow-up where you come here, you get seen, doctor tells you what you need to do, you do it, and then at a certain time you come back, and
Sure, sure.
because you don't have that access
Sure,
to a clinic,
sure.
then that's where we're developing those protocols now. In our next mission, we're going to have public health's division that gets people applied and qualified for public assistance
okay.
at the MIP and Medicaid with us,
Yeah,
so
okay.
that on the spot, if we're able to get people into those public programs, we'll do it, right?
Oh, okay.
And then
okay,
so
okay.
once you're in that program, then you have the community health centers, you have public health that you can probably be be seen at, or any other private clinic that still accepts MIP or Medicaid.
Yeah.
But for the most part, this is a mission, a medical mission. We don't intend to keep any
Records.
any
Yeah,
records.
yeah.
We understand the privacy of these patients. So the main thing is getting them to a physician, to a specialist, and getting them the help. And after that,
Yeah.
it's
The reality of the world of outreach is that we like to look long term. We like to be able to say, hey, this is the first step of the medical process,
Right.
and seeing you to a hospital or a clinic and all that. But the reality is, some of the patients that you're going to see, this is the only time they're going to be
That's right.
seeing physicians or medical
right.
practitioners,
That's right.
and all that. And it's sad to hear that,
That's right.
but it's welcoming for folks who wouldn't go to medical facilities as well, right?
That's right.
Yeah.
So the procedure and protocol and the schedule that that we're looking at now is that when we're in a certain village, let's say this week, we'll make sure that in 3 or 4 weeks, or at least in a month's period, we come back to that village, so that perhaps if that patient or that individual wasn't able to go to a clinic or wasn't able to get to another physician, a permanent physician, then the same doctors we had that we were there 3 or a month ago would be back with us there.
Yeah.
So that because it's very different when doctors go out now and do missions in the Philippines or in Chuk or in Palau. It's a one-time shot.
Sure,
right?
sure,
But this
sure.
is different. This is
Sure.
where this is here.
Sure.
This is home. So we understand that, and we got to develop a system that. Knowing that we got to come back to these individuals.
I'm surprised too. I mean, and it's numbers that are unbelievable. I mean, I don't know how high it is, but it's one too many anyway. We live on Guam, right? Folks, most especially younger folks that get pregnant, who don't have access, who have never had any prenatal care.
That's right.
And I mean, this is something that at least get some kind of advice and some kind of program to get it to watch the progress of the pregnancy.
Yeah, and so that's why when we first announced this mobile care clinic, we said this is the anchor. This is the anchor for all the services. So last week when we did it, we had public health there. Their outreach program was there. We had the lupus awareness group of Guam that was there. We had the Guam Marianas Lions Club that was doing, doing vision screening, and then we've had arrangements already made with other groups because just like you said, if it's a pregnant mom who is the first time being pregnant, doesn't know the services there, we want to have these outreach services there for them so that it's not just getting the ultrasound or getting the physical, but touching these individuals so that they can provide them that assistance in just navigating through the system.
I understand you partnered up also with Paradise Fitness, right?
That's right.
Paradise Fitness, but also in the prevention aspect of things, right?
Right.
I mean, you're not just detecting what the problem is and diagnosis and prognosis, whatever it may be. You're also doing, I mean, in a sense, trying to do as well exercise prescription well, right?
That's right.
Yeah. So tell us about that part.
Yeah, just like the front of this mobile clinic, you see a group of exercise enthusiasts, right? And the big tag there is exercise is medicine, because really we know studies have shown, and we know personally that to prevent any of these diseases that are out there now, it's what we do to our body.
Sure.
Exercise is the best thing that we can do for ourselves. And so they're part of the program. They're giving away free 1 month gym memberships, and we're trying to work with them to get more long-term memberships too, so that if individuals really like it and want to be in a gym setting, that they're able to, because that's how we're going to help prevent a lot of
or
things.
again, just a prescription in the sense this is what you can do outside of the gym
right.
setting. You don't have if you don't have, I mean, if they definitely don't have money for insurance, they probably don't have expendable income for a gym membership. But there's always a place to walk to.
That's right.
And so there's always a prescription for that.
Right.
And they always say an ounce of prevention is worth a pound of cure, right?
That's right.
Yeah.
That's right.
So so how is it being received in the medical community? Who are on board so far?
Yeah.
Who are the doctors and nurses on board so far that are willing to avail themselves to volunteer?
To this, I gotta say, Senator, that last week's event was what was really inspiring, because we had about 10 doctors that came. We put out a call and said we're doing it on Sunday. If there's anybody there, especially family practice or pediatricians, please come out. We thought we would get like 1 or 2 because it was a Sunday, right? But it ended up we had 10 physicians.
Oh, wow.
We had family practice. We had pediatricians. We had an anesthesiologist that came and just helped us out. We had Dr. Carlos, the neurologist, that came out, and he was there. So by the doctors, it was supported. And they've committed to be able to continue this effort. Nurses, it was even more overwhelming. We had about 50 nurses.
Oh, wow.
We had a group from GMH that came out. GDOE nurses came out in full force as well. We had some from the other private providers. But that's an indication that people are on board. Now it's just a matter of getting them together, and putting a schedule together so that it can work with their schedule.
Well, no, fantastic. And I tell you, I'm going to hold it to you that you're
Yes.
going to put a schedule together.
Yes.
You give it to us, we'll put it out on the radio,
Absolutely.
where you're going to be that weekend, where you guys are going to be
Absolutely.
parked, from what time to
Yes.
what time, and again, what things to bring,
That's right.
for that, and who's going to be there in case if it's going to be a gynecological
Yes.
doctor that here or something like that, or a dentist. They know, what, if their concern is in that area, right?
That's right.
Yeah.
That's right.
So again, this is a big endeavor. And as much as you put everything together, this will become a costly
Yes.
endeavor, Senator. If companies and or individuals, again, pharmaceutical companies over there, how can they get a hold of you to say, hey, look, we how can we work together? What can we do? Is there equipment that you need? We can loan you, or we're no longer using this or something like that. I'm sure you're willing to accept those things, right?
Absolutely. So up to this point, all the assistance we've getting, sponsorships, I've all been in kind.
Okay.
When I decided to purchase this from Chuck Tanner, a friend of mine, I also worked together in the office. He's the one who actually built this, and put it together. It was a personal endeavor. I talked to my wife and said, this is something, that is going to be good. But the assistance we need, you're right, is the in-kind services, whether it be the medicines we need to give, whether it be the gym memberships that we want to give, and we want to open it up to everyone else too, or the doctors that provide some of the supplies.
Sure.
It was last week when they were here, I guess we didn't have a scale. Well, we had a scale, but we didn't have the height chart, right?
Okay.
So what we did is someone had a tape measure, so we just used a tape measure and taped it up. They said, Dr. Santos, Edna Santos said, "Don't worry. Next time we're gonna, now we know we're gonna put these things here."
So now they're seeing what you need.
That's
right.
right. That's right.
Yeah. No, that's great. And I tell you, you have a generator, but at the rate that you're going to be going around,
Yes.
you're going to probably need a generator as well, and you probably need a gas company too.
That's right. So the key is, like when we were at Paradise last week, or if we go to a village with a community center, we can just plug in. But if we're out in the remote areas, that's where we need a generator.
There we go. Anyway, and take a quick break, come back. We'll probably just have time to say goodbye, but okay, thank you.
Thank you.
Be right back.